I guess it was instinct told me that there was something important happening here, and that I wanted to see it. I wanted to find out for myself, and turns out I was right. I think there is something important happening here. I think it's a really unique event, and I think that it's unique on a number of levels. One, because there is just so much energy from the people who are not jaded, who are not, who are just kind of optimistic and enthusiastic. And I think there's a kind of a modesty about the event, which is good. It's not trying to overstretch itself. Every time one of the organising teams say to me, "Oh, we've only been in existence 5 years," I think 5 years is a long time, But there's this modesty. But I think also there's just the idea that it's based around ideas. It's just really important. There's not enough of that anywhere, and so I think that's a really good core value or principle to run an event like this on. I think you should make an effort to make Melbourne the global health hub for Australia for that reason, because as you find more people, I live in a small place, and no one goes there really for global health reasons specifically. We have the occasional conference. But when someone comes, I know about it, and I sometimes go to the airport and meet them. You have to take those opportunities. So I think you do need to kind of, if you're going to keep it in Melbourne, Melbourne needs to be the global health hub for Australia, and I think you should talk to the city about that and find a mutually a win-win situation where they'll be willing to do more for you. And you could help them bring other global health events to Melbourne to give you that exposure, however small they might be. The other thing is I don't think you want a kind of a shotgun effect to building your network. It's not a question of critical mass. I think it's the entry point, the entry points that you're looking for, and that critical kind of evidence to action, evidence to policy nexus, I think, is where you should be looking. And there are existing places where that happens. Some are good, some are bad. That might be specific centres within Asia Pacific. Like, for example, you should be talking to places like ICDDRB in Bangladesh, which is really at the coalface of evidence to action. They're looking at research and data that's available and turning it into programs in Bangladesh. But you can also be looking at structures that are already existing globally in global health, saying, oh, that's a really good entry point for us because it's at that nexus. And then once you've got that, then you network within those environments. You don't need a network of 1 million people. You need a network of 2,000 of the right people. So I would go for quality rather than quantity. Everyone faces this challenge individually today, and I think one way you can probably do that is with your own strategic thinking, and think where are the areas that you should really be listening. Maybe you can have a division of labour. You could, young organisations have communication strategies. They don't very often have listening strategies. And I think that this is a point where a lot of organisations are getting to. We should be very selective about what we listen to and very purposeful about going into new areas. And you can't do everything at once. You're not going to be able to cover all 17 SDGs and all the global health dimensions of that. But you could say, in 2016, we're going to make this particular issue and its interface with global health a priority for global ideas. And just do them one at a time. That's the way I'm beginning to feel individually, as a personally. I can only focus on one interface at once, and be honest with that, and not try and do everything at once. So you may need to have strategic priorities. You may need to link that to not a theme, but somehow link it to having a sub-theme, an underlying theme for this forum each year. That, and that way that's going to help you grow your network as well, because you'll be attracting people from a particular area. Everyone's really busy. sometimes I feel like I'm having a productive day if I just do get my priority list done. And we're doing this kind of cognitive triage all the time of the things that we give our attention to. So as people, we're kind of a bit more aware of the conversations we have with one another. But as organizations and institutions, it's subconscious. It's a kind of an assumed truth that we're doing the best we can. I don't believe we are. But it's not a huge change that we have to make to start listening more actively and accepting the fact that we don't have necessarily the best view or the most accurate view or the most evidence-based view from where we sit. That there are other people who think completely differently, and we just have to start listening more actively, and suspending our own view of the world just long enough to maybe hear something else that we weren't expecting. Generally, the most important parts of any conversation between two people are the parts that you couldn't predict at the beginning. And that's the same when organizations talk to one another. So I think we need to listen a bit more actively. Trust is not only important, but it's something we have a huge deficit in right now. If you look at surveys that have been done over the last decade or so, and there's some that have been done by big PR companies like Edelman, who do the Trust Barometer every year, and we see a real shift away from trust in governments. Even the brand strength of NGOs has weakened over the last decade, and actually people are beginning to trust companies much more than they used to, as like not the honest broker necessarily, but somebody who is reliable in terms of capacity, performance, and things like that. Quite surprising. And so trust is very important, and I think that's always the first step of establishing a productive and a generative, creative dialogue. Is in order to listen to somebody, you have to trust that they've got something to say, and it's not philosophical; it's very practical. The difference between digitizing and cognitizing. Let me use the analogy or the case study of the World Health Assembly, because recently I found or discovered that all of the resolutions of the World Health Assembly, they've just finished digitizing the entire record of World Health Assembly decisions in searchable form since WHO was created. So you can now go back and you can search and look at 15 years ago, 10, 20 years ago, 30 years ago, what were we thinking about specific issues in global health at that time? That resource exists. But nobody has kind of mapped it in terms of its significance. And I'm not saying that's something I could do or you could do, but together that's what everybody is going to do. We're going to be putting those digital corpus of information under a microscope and work out why it was significant, and work out what are the patterns, what are the evolutions that show us the way forward. If we ever try to model the future, we have to understand the past sufficiently to understand what that common history is, what that shared history is, so that we can understand what we should be aiming for in the future. If algorithms can help me find a pair of shoes like my best friend would if we were in the shops together, or if Amazon can say people that like this also like this, why can't we use those algorithms for social and public good and find those kind of patterns and relationships that our own brains are just not adequate enough to handle? One of the most unique things about the forum has been the way that it stimulates different parts of your brain. Most health-related conferences are about data dumps or information downloads or so on. And when I first looked at the program of the forum, I was a bit curious about, the artistic pieces of the program, and just the way the program is put together. But now, having gone through the past 3 days, it's been really refreshing when you're tired at the end of the day and someone's talking to you about, the artistry within data, or you hear the view of a philanthropist who really doesn't know very much about science. I found the program really balanced, and that's really unusual. That's really refreshing.